Hey everyone, Dave Kittle here, one of the partners in the Cash Practice Mastermind and one of the partners at cashbasedphysicaltherapy.org with Ron Miller. What we do inside the Mastermind and with many of our students is we do sales, role play, and role-playing phone calls and video calls. And what that does is it keeps all of us fresh and crisp with our responses on how to best build rapport with patients, listen to patients, and get ready for all their common objections so that we have great rebuttals for them. And all those common objections you guys have all heard: that's too expensive, I don't have that budget right now to pay out of pocket, I want to use my insurance, I need to think about it, I should sleep on it, I need to speak with my spouse first. All of those common objections, we review those and we pretend, one of us will be the PT, one of us will be the fake prospective patient, and we go back and forth, and we found great results by doing this. And as far as I know, I believe I'm the only physical therapist in the country doing this. I don't know if anyone else is, but I know that this is super helpful for our members and our students. So I am joined with
Eric Otero, physical therapist, South Florida.
All right, so Eric's going to be the physical therapist, and let's say I call you or meet you for the first time. Let's say a phone call. So hey, Eric, I have, my name's Dave, and I have low back pain, and I was referred to you by one of the other CrossFit athletes, Tom. I have a great United Healthcare plan. Do you take United Healthcare?
Hey, Dave. So how's it going? I'm glad you came to me from Tom. Tom is a great guy. I just actually helped him with a similar situation. So I'm glad he can bring you my way in regards to taking care of your issues. So getting back to whether I take your insurance or not, what I like to do first is kind of make sure that we're a good fit for one another, because I think that's really important as a practitioner to make sure I can actually solve the issues that you're dealing with. So one of the things I like to do is just ask you a couple questions to make sure that we're a right fit for each other. And once we kind of get that established, I can make sure that I can give you exactly what it is cost per session. That way you can either submit it to your insurance with an itemized super bill that kind of breaks down everything per session, or potentially get reimbursed whether you met your deductible or not. So just a little more before we kind of dive into that. Tell me about yourself and tell me about your low back pain.
Sure. So then at this point, the prospective patient, I would just go on and on about my back pain, my issues. Eric would be digging for what are my not just pain levels or all that, but the things that I cannot do that I want to be able to overcome. I would probably describe as long as Eric would allow me to talk. It really just depends on the patient on the other end of the line, if they are short or if they are a talker and they want to go really long. So Eric, let's say you make up a couple of common goals, like whatever those might be, for me to get back to CrossFit and for me to jog on the weekends with my spouse. So I'm spending quality time with my spouse, and not just, to get my pain 6% better. So we would continue into the phone call, and let's say we get to the point where Eric, the PT and the patient, Eric has established enough rapport where, Eric, you feel like you and I are a good fit together. Yep. So if you feel like we're great fit and a good fit together, where you would be able to help me and you feel like I would be the right patient for you and vice versa, then what would be your next step?
So Dave, now that we kind of outlined what your goals are, kind of my treatment process and the different phases, phase 1, kind of get you out of pain. Phase 2, kind of get you moving, just with some small moves, but still transition from phase 1 in regards to like some soft tissue work, whatever that entails. And then phase 3, getting you back to the activities you really want, whether it's CrossFit, running on the beach, spending time with your wife the way you want. Does that sound like a plan that's right up your alley in regards to getting you back to the things you enjoy most?
For sure. It does actually. That makes sense.
So perfect. Now let's go back to that initial question in regards to whether I take insurance or whether, I do not. So it's funny that you bring that up, because actually last year I was in network through an insurance company, and last year compared to this year, the services I'm providing are still the same, but I'm actually getting reimbursed less. So most PT clinics out there around the area are actually trying to see more patients to try to make ends meet in regards to what they were making last year compared to this year. Now, as a practitioner, quality care is super important for me. And in regards to my patient outcomes, I can't sacrifice that. So I do not take insurance directly, but what I do offer to potential clients is itemized super bill that really kind of breaks down all the procedural codes, everything you need to submit to your insurance company for potential reimbursement. Now, after you're going to get that through an email, and you're going to kind of get step-by-step instructions on how to submit to your insurance company. But once you get that established, we can really kind of dive into your goals. Hold on, Dan. Sorry, my little Frenchie's like
No
all over
problem.
me.
No problem.
But once we get that established, we can really kind of dive into your goals and really kind of move forward with that plan of care. Now, on a scale of 1 to 10, how would you rate that plan in regards to getting you back to all the things we mentioned in regards to your goals and kind of how we're going to map it out? How does that sound for you?
I would say that sounds like a 10. It sounds like you kind of outlined a good structure for me to possibly work with me and get me better. So yeah, sounds like a 10.
Yeah, sounds like a 10. So just a guarantee I'm going to give you as well. If you're not content with your first 3 visits, I'm going to offer you something that you're not going to get anywhere else in regards to anywhere in the PT clinics around here. I'm going to offer you 100% money back guarantee if you're not content with the progression you're making, or if you're not happy with the service I'm providing. Even more, since you were referred to me by Tom, Tom's a great guy. I respect him, and I'm glad I can help him. I want to offer you a professional rate of 125 per visit. Now, normally the cost per session is 150, but since you referred from Tom, I really want to make sure that I take care and give him the same kind of skill and quality service that you deserve. How does that sound?
Wow, that sounds pretty good. So yeah, I get some money, get to save some money because Tom sent me over, and then you said if I'm not like feeling better or improving in up to the first 3 visits, then you do like a full refund, or is it like a partial refund, or how does that work?
No, so my guarantee to you is you're going to get 100%. Let's say if it was 125, we did 3 visits, you're not happy, you're going to get that 375 right back to you. So my guarantee compared to other insurance companies, they can't guarantee that. You may have a copay, through your insurance, but they can't give you that copay back. And, who knows how many visits you're going to see them where you might even be handed down to a PTA or a tech, someone who you're not even seeing from day one, opposed to you're going to be with me one-on-one for an hour each session, getting the quality of care that you deserve, getting you back to the things that you enjoy most. How's that sound, Dave?
Gotcha. Yeah, that sounds great. I just was looking at my insurance card when I called you, and I noticed that I have a $50 copay, and then I just wasn't expecting or realizing that someone like a physical therapist like you or anyone else would be charging more out of pocket for those visits. I get it and I understand it, and Tom spoke very highly of you, so I totally understand the value of it. It's just a little bit more than I thought I would be paying out of pocket. So is it cool for you if I just speak with my spouse about it and maybe just get back to you?
Dave, I completely understand. I agree. It is a premium service, and it's probably something you weren't really expecting to pay compared to that $50 copay where, you kind of know where you're kind of getting yourself into. But in regards to that $50 copay, I'm not sure if you met your deductible or not, or the other associated fees or your co-insurance. You still may be paying out of pocket regardless in the grand scheme of things. And if you're going to be with a practitioner or therapist who may be handing down to a PTA or a tech, you may not get the quality of care that you deserve. So the longer you kind of wait, and the fact that you're still going to pay out of pocket regardless, I can guarantee the 100% money back guarantee is going to be right for you, because if I'm not giving you the quality of care, the service that you really want, you're going to get that right back. So you're going to get that upfront value, right back to you. And that's something you're not going to get back from an insurance physical therapy company. Also, too, I understand speaking to your wife is super important in regards to your own healthcare. I talk to my wife about big decisions all the time, and I think it's important to have her involved throughout the whole process. And I know my wife would personally want me to get what's best for me. And I'm sure your wife is the same. Would you agree with that, Dave?
Yeah, I would agree. You're right that she wants me to be healthy and stop complaining about my back pain and get it figured out. So yeah, you're right, actually.
So, it sounds like we're a good fit together, Dave. Would you agree?
Yes, I agree.
Okay. So that being said, I actually have an appointment available for you 5 p.m. tomorrow. Does that sound like something we could schedule? Or if I actually have a 4 o'clock the next day, what works better for you?
Let's go with tomorrow at 5 p.m.
Okay. All right. So, Dave, just kind of going back to what I initially said, now that we're a right fit, I'm really going to kind of break down the cost per service. That way, you know exactly what you're going to be having to pay out of pocket for each session. Okay. I think that's important. That way, you kind of know exactly what you're paying each session, as well as how to get a potential reimbursement from your insurance company. I'm still going to honor that 100% money back guarantee after the third visit. If you're not content with everything, going forward, then you're going to get that money back. And that's all going to be outlined in the email. That way, you know exactly what's going on throughout the whole process. Okay.
Amazing. Perfect. Okay. Booked, closed, paying you cash. All right. So now, Eric, did you speak like that to patients before you joined the Mastermind?
Nowhere near.
What was it like before you and I spoke and you met Ron Miller and we were showing you different content and different ways to approach this whole conversation? This is the toughest thing, the first interaction, the first phone call with prospective patients for you as a cash practice owner and for everyone else across the country that wants to get into this whole cash-based physical therapy world and have more time and freedom, control their own schedule and all of that. So what was it like before?
Before, there were a lot of blanks, like people would ask these hard questions and there would be a lot of apprehension, lack of confidence, in regards to, like, I'm a very confident clinician, but, having people understand that value was always a little hard for me to display, especially through a phone conversation where I haven't met the person. And after, we've had these practice sessions between, myself and yourself, as well as I've worked on it with Kyle, my colleague as well. It's much more fluent. I feel much more confident. For me, it feels like it's smooth. I'm keeping the conversation going opposed to just letting it stall, having some awkward silence, and then letting the potential client get lost in their own, rebuttals or thoughts. I think the biggest thing that hit home with me and with the way you guys describe this whole sales aspect of it is leading the dance. I think that's helped me tremendously in just kind of directing them, because they're coming to you already for a reason. So if you let them lead the dance, they're going to lead it elsewhere out the door. Opposed to if you're leading it, you're kind of breaking it down, what they want to hear, how they want to hear it, and that you have a plan. And that's much more impressive to them opposed to a typical outpatient, insurance space, whatever it is. We're like, all right, well, let's have you schedule over here.
And that's
You're
it.
getting, yeah, and that's it. You're getting down to why they're coming to you and what their issues are. And that level of connection or the rapport you're building with the patient has been tremendous and helped me make, a huge increase in closing sales,
Right.
closing call.
Yeah. And just to recap, I know you and I both have to run, but I want to break it down a couple things really quick about what you said. So if anyone else is listening to this, they might be, why did he say certain things and what all that was thought out, all that was kind of worked on and practiced, and it was almost like choreographed. And so the one thing is like the 100% money back guarantee. Ron Miller offers that in Florida. I offer it in New York City. It has helped my conversions greatly because I take the financial risk off the table for that prospective patient. Knock on wood, I have not had anyone ask for a refund in 2018. It might happen, and if it does, then I will refer them to another colleague, and maybe I wasn't the right fit for them, or they need some differential diagnosis with someone that's has a different skill set or something. Another thing you said was the phases. And so I even sometimes and I think you probably would do this as well, but the phases of saying, okay, the first phase would be visit number 1 through 3. And in that visit, we're going to try to calm things down, soft tissue, more hands-on work. Phase number 2, is visit number 4 through 7. And in that visit 4 through 7, we'll do a little bit of some of the hands-on stuff as well, but also start to transition you into doing more mobility work, into more drills, into other things that make you a little bit more independent and work on movement. And then phase number 3 would be from, let's say, visit number 8 moving forward. And don't say from visit number 8 to 10, because what if they want to see you more than that? They might fall in love with you in terms of your value at that point. So say phase number 3 from visit number 8 moving forward is where we kind of put it all together, get you back to the sport, the CrossFit, the goals of walking or running on the beach, whatever that might be. What else did you say particularly that it would be good for you to break down real quick, Eric?
I think what I was talking about in regards to why I don't, take insurance and why I'm a cash-based practice. I think that's important for people, I guess, to understand. Once you kind of say, like, put in perspective, we're like, hey, I've been through that, I've done that, but that's the issue with, a lot of corporate physical therapy practices compared to what I'm doing. They sacrifice quality of care, and it's more like a mill, and realistically, within our profession, we got a lot of negative feedback because of that. So the fact that you could stand out and it's going to be a different experience from what they may be used to, I think that's very helpful, and that's something they really appreciate. And that they're more enticed to pay right up front, because you know what? I've had that experience. I don't want that. You're different. You sound like my guy. You sound like you're listening to what I want to get back to. Let's do it. I've had people actually almost throw their cards at me, in regards to paying up front, just because you sound like a really, really good fit and you really are about them, so I think that has been really, really helpful for me as well.
That's awesome. So again, you and I both have to run, but thank you so much for this. This, by the way, guys, this was would you say this is your 3rd time speaking one-on-one with me?
Yep. 3rd time.
So 3rd time. The first time, it was obviously not as good. The 2nd time was somewhere in between. And then you guys are seeing the 3rd time of Eric and I speaking one-on-one. Now, yes, you have access to the Mastermind content and the videos, but it's hard to practice this unless you actually have a colleague or a friend or, one of your instructors here in the Mastermind, or someone else that can point you in the right direction of exactly what to say, how to say it. And then, let's tweak that, maybe say this instead. And we're writing notes down and taking notes about how we can improve even my pitch and your pitch and everyone else's. And so you've come a long way already from 3 calls, 3 one-on-one calls like this. And I just want to kind of frame that in the point that, you just have to practice. You have to put in some of this effort with some of the right kind of proven rebuttals and responses. And these are just proven strategies that Ron and I, went through and made already. And so it's why go and make all these mistakes on your own? Instead, you could just shorten your learning curve and learn from us. So, so we can hopefully save you guys the frustration that we had of people hanging up on us, or, just going to call an in-network clinic or something like that.
Definitely.
All right. Awesome. Eric, thank you so much for your time. Everyone else, thank you. And I hope that helps.